Hello, my name's Joel Dunning and we're here at EACTS 2023 with Giuseppe Cardillo and René Petterson. They are the chairman of the brand new GGO guidelines, which have been published actually today, which is a fantastic achievement. So congratulations both of you. And maybe if I start with you, Giuseppe, tell us about these GGO guidelines, how they were created and the impact they're going to have.
Many thanks, Joel. We are very proud, me and René, of this production that we have done, because the GGO guidelines cover both subsolid, both pure GGO nodules and part solid nodules. So we try to address through a 2 years trip that we have done with all the friends helping in this project to address the issue of subsolid nodules. So I think that even René can proceed and explain all the methodology, but I think it's very important that with this guideline we have tried to put some clear in this issue.
I really agree. It's been a wonderful cooperation between the EJCTS and ESTS. So a task force group from each society was initiated in 2021. We had our first meeting in December 21, and finally we last year at the EX meeting in Milan we finalized the recommendations, and then there's been a publication process until now, and we now finally it's published online this morning, and we presented at ESTS meeting in Milano in June, and now again here in Vienna, where we are now for the EJCTS meeting. And I just want to congratulate all our experts in the task force for the extensive work that they put into this, and to the juniors who have really been very helpful in producing these guidelines. So we are very content we've got this far.
Maybe tell us about the chapters. So we've got pure GGO chapter, we've got a part solid GGO, we've got multiple GGOs, and then we've got a little bit about how to take them out. So maybe go through the key recommendations maybe in each chapter.
Yeah, we can do that for sure. So first of all, the overall aim was to produce a guideline for surgical management, because there are guidelines on when to intervene, how to follow up, etc. on GGO lesions, but there's no specific guidelines on the surgical management. And for pure GGOs, which was the first topic we looked at, normally we would say pure GGOs should not be operated. They should be follow-up according to Fleischner lung rats, unless there is a 5 millimeter or more solid component. They should normally not be operated, but in case there is an indication for operation, for peripheral pure GGO, we recommend only a wedge resection, no lymph node dissection. For a more central GGO, segmentectomy may be needed, but again, no lymph node dissection for this group. And in most cases of pure GGOs, this would be something where you maybe operate for another cancer. Maybe you're doing a segmentectomy in the lower lobe, there's a pure GGO in the upper lobe, we want to resect it. So we think it's important in this group to be lung sparing, and we're also concerned with overdiagnosis, which is a valid criticism of lung cancer screening trials. So we try to be like to the edge in this recommendation on pure GGO. And maybe Giuseppe will explain about the part solid.
As regards part solid GGO, we suggest a different approach. First of all, we should involve the patient in the tactical decision making. And when we decide to evaluate for surgery, we need an intraoperative, a preoperative diagnosis. So we suggest to make a biopsy before. And when we go to surgery, we suggest to do a minimal invasive approach, either by VATS or by RATS. Furthermore, it's important to make a localization of the nodule, because in most of the cases, the nodule is non-palpable, and we don't have in minimal invasive surgery the possibilities to touch the nodule. So that's very important, localization, minimal invasive approach, and as regards the surgical procedure, we recommend anatomical segmentectomy, plus lymphadenectomy. So this is what we suggest, because part-solid nodules are a little bit different from non-solid nodules.
And so we've got a chapter as well on multiple GGOs. So you know, sometimes we see 2, 3, 4. So what are the recommendations you're presenting today about that?
Yeah, well, the evidence is very sparse in this area, I must say. But the recommendations for multiple GGOs is to address the key tumor, so the one most suspicious, most invasive, and then follow up on the remaining nodules, depending on how much lung parenchyma there is the possibility to remove. So this is a more practical recommendation. So go for the most suspicious nodules, leave the rest for follow-up, because most of these tumors, and that's an important message, are slow-growing tumors, and there's a lot of things to take into consideration, such as patient's age, comorbidity, lung function, etc.
Absolutely. Well, I think it's been an absolutely amazing project. You guys have led absolutely fantastically. So congratulations to both of you. I think it'll be free full text online from the European Journal. Would that be right? So yeah, go and download it today. And I've already told our MDTs about it, and it's already been very helpful as I gave them a few sneak previews. So congratulations, both of you. Well done on this absolutely brilliant project.
Thank you very much.
Thank you.